for you to go through. Okay, bit of a history. So I'll start your 2 minutes timer. Whenever you're ready, you ask me to move the slides, I'll move it for you.
Yes, ma'am. The next slide. Next slide, ma'am. First slide, ma'am, please. One more slide is there? Is there one more slide?
No, no, only 3 slides. Happy to start, dear Fatima.
Yes, ma'am. Okay. Hi. I'm Dr. Fatma in the emergency today. And am I speaking to Mr. Michael White?
Oh, yes, doctor, that's me.
Yes, Mr. Michael.
Doctor,
I
what's
see.
going on? I have been waiting here for the past 3 hours. Nobody is updating me anything. How is my wife, Erica? Is she okay? I wanted to see her.
Yes, Mr. Michael. I'm here to update you about your wife. And I just want to let you know at the moment she has been taken care of and she is in the post op and recovering. Okay. So I will be telling you about the sequence of
Where is
things.
she? Where is she? Is she in the ward? Can I go and see her now?
No, yes, we will let you go and see her soon, Mr. Michael. But as of now, when they give us the permission to see her and when she's stable, I myself will take you to and see, and I will go and let you meet her. Is that okay, Mr. Michael?
Okay, that's fine, doctor. Is she okay?
Yes, as of now, she is stable, and we have done the necessary emergency treatment for her. So I'm sorry for what has happened, Mr. Michael. I know that things did not go as the way you had wanted the care to go, but we are there. And it must be really distressing for you and your wife now, but we are there to help you and support you through this.
My God, doctor, you're scaring me. What happened? Is something wrong?
Yes, Mr. Michael, that your wife had come to the emergency in a collapsed state because she was diagnosed. She was seen by our senior doctors, and she had a complication following the procedure which she had undergone. That is the uterine artery embolization.
Doctor,
For
I know all of that. I was the one who brought her to the emergency department.
Yeah, I'm sorry, Mr. Michael. That is, yes. So we had to take her for an emergency because maybe they have pre-operatively told you one of the complications of this procedure is that it could lead to infection, and that is why she had that. It is a rare complication, but yes, she had that complication, and we had to deal with her. Our senior doctors have seen her. We have also raised an incident report to understand what has happened, and we will be very transparent as to what has what went wrong, and so that it would not occur again. Is that okay?
Uh, that's fine, doctor. Yes, but what has happened now?
Okay, now she, when she came in, she was brought in a collapsed state, and then we had to resuscitate her initially with fluids in her arms and antibiotics, and then we had to, and our the the our shared group of doctors, the senior doctors were involved in her care. Our the consultant and the anesthetist, they all and the senior nurse and they all were involved, and they had to take this decision of taking her to operating in her again. And I'm sorry to tell you that because of this problem, we had to remove her womb.
What? What are you saying, doctor? Are you talking to the right person here? How can you just say that you have removed the womb? Who has given you the consent? Have
I'm
you ever
sorry.
consented for this womb removal at all? Oh my God,
Yes,
doctor.
I know this must be really devastating for you, Mr. Michael, to hear this. But you know that we had at that point we had to save your wife's life. And this is one of the rarest complication of this problem.
Oh, this was never explained it to us, doctor. All they told is that, this is going to be a straightforward procedure. You can expect some infection, bleeding, and things like that. And this is something they never told us.
We will look into that matter, Mr. Michael, and we will raise, as we have said, the incident report, and will be very transparent in, bringing out whatever the outcome of this investigation was. Why did they not tell you? Because this is one of the complication does happen with this procedure.
Is it that common, doctor, that you're saying that this should have been told? We were never told, doctor.
Yes, Mr. Michael, I'm really sorry, but as I told you, we will get back to you. We will we will also alert our management team to get involved and find out the reason why it was not informed to you about this.
I don't know, doctor. I mean, when she developed, we got discharged on the same day, and then we went home. Within a week, she developed some fever and pain. And then we went to the GP. He prescribed some antibiotics. And he should have told us that this is something that he's suspecting. If he had identified it earlier, maybe we could have saved all this, isn't it?
Yeah, it it is not that somebody has missed on anything that was it could be avoided, but this is one of the rarest complication of this procedure. And once it occurs, then there is the only way to save the patient's life is to have her womb removed. Now, I want to discuss. I know it must be very devastating, Mr. Michael, but
Doctor, of course, doctor, we have been trying to conceive for the past 4 years now, and you're saying that you have removed the womb without even consulting us. How am I supposed to face Erica now? How are we supposed to become parents?
yes, I know this, and let me tell you, we have just removed the womb, and the ovaries, that is the egg baskets, they are still there, and we have not touched them. So can I explain the other options that you could have your own biological child?
I don't know, doctor.
I'm sorry. I'm really sorry, Mr. Michael. So the other option there would be that the egg baskets are there, and from Erica's egg basket, once she recovers, we will be referring her to the fertility department, and they will be taking her along as to how to get the eggs out, and they will fertilize with your sperms, and then you could have the surrogacy done. Have you heard about surrogacy, Mr. Michael?
I don't know, doctor.
I'm so sorry. I'm so sorry.
No, I'm not happy with the care I
I
have received, doctor. I really want to sue the hospital.
I will. I can connect you to the. We have a department called as PALS, Patient Advisory and License Service. You can file your complaint there, and they will also come back to you with whatever has been missed or not taken care of. And yeah, you could, you could go and file your complaint there. But Mr.
No, I
Michael.
don't want to complain at all. I just want to sue the hospital, doctor.
I'm sorry, Mr. Michael. Let us see. As of now, what the incident report has come and what was the
No, I
outcome.
don't believe you guys. I'm not interested in discussing anything with you guys. You are pathetic. I mean, the care we have received is pathetic.
The people who do give the care are all have got the writers training, and they are deemed competent to have to take care of these kind of emergencies. And this was the best thing we could do for Erica at that point. Are you with me, Mr. Micah? And now she's stable, and we will definitely help you. I know we will connect you to counselors, both of you, and also support groups, ours, who can also, help you to go through this very difficult period, Mr. Michael. And as I told you, can I tell you about the surrogacy, which you can have?
No, I'm not interested to know any of my options, doctor.
Uh, I'm so sorry, Mr. Michael, but it is more important that we save your wife's life as of now,
So
and
you're
then
saying that you have done a big help in here, isn't it?
the choice was to remove the womb. Otherwise, the infection would have spread to other organs, and we would
Right?
have lost
Yes, dear
Erica.
Fatima, your time is up. The talk is over.
Madam, you're so tough.
Right. Yes, over to you. What is your reflection, my love?
I don't know. I'm not coming back. I was not. I was not convincing at all to Mr. Michael.
That's okay. It can happen. It doesn't mean that you are not in a right direction. Okay. So you might encounter a tough role player who was difficult to console. Doesn't mean that you have gone in a wrong direction or you failed to convince them. Okay, you just had a difficult patient, as simple as that. Okay, even in the exam, it should not affect your next performances. That, oh, that station didn't go well for me. I tried my level best. These
Mhm.
will not be solved in one go. Okay, this requires a lot of
Lot of
debriefing
counseling.
stations, counseling. It's something that they will go into the denial mode, isn't it? Then they'll come to an understanding of that whatsoever has happened. Okay, then they will move forward. But don't think in the exam that you failed as a candidate or as a safe doctor to convince him. Okay, you were in a right direction and you did the right thing. Okay, your
Yes.
negotiation skills were good, your speed was good, the empathy was good. A bit of a structure that was required anyways, we'll come to that. So yes, I
Okay.
will hear from others that how did Dr. Fatima did this particular station. Anyone who wants to say something? No one?
Ma'am, I just wanted to ask. I had this station in my May exam,
And
and
the role player was not talking at all.
yes, the role play was exactly like you. In fact, I would say more stubborn, and he was not interested in listening to the fertility options. Like when
Of
I was
course.
explaining,
Yes. Yes.
let me take you through the different fertility options. So he was only stuck at just let me know where my wife is and how is she. I just want to know about her. I do not want to listen to the fertility options. So,
Yes.
uh, how can we complete the station then if we are not giving the fertility options to like if we are not completing the station, how will we get the
So
Uh,
that I got your point, Dr. Pooja. That's the problem that generally the many candidates would get into, because you guys will read the template or prepare something that is given for as a part of your template from any platform for that matter, and you go in a certain way that you should understand the knowledge. You should understand. You should have some situational awareness there, that what the role player is interested to know, and that's where the maximum marks lie in there. Okay, if they are not interested, you should not be going and discussing that. Okay, and it's always important to signpost. Okay, if they are not asking that how we will be able to conceive now, he might not ask this question. It may not be the topic of interest at this point of time. It's important for you to signpost that I truly understand that it is a difficult time for you. I know you have been longing for the baby for the past 4 hours, and this is not the outcome that you ever expected. But then, yeah, this is something that has happened, and now there is no womb, and she'll not be able to carry the pregnancy all by herself. There are certain options that we can definitely think of that will give you the biological child. So, one is the surrogacy, another one is the adoption. Okay. But then I am not going to discuss and tell him about the surrogacy or the adoption in detail. Okay, that is a situational awareness. Me as a safe candidate, I will adopt that. I will quickly say that the ovaries have been retained. That means that we can take the eggs from there, fuse it with the sperms, and then another lady will carry the pregnancy for you. But then again, I will always signpost that I know this isn't the time for you to discuss, for us to discuss right now. It's important for us that Erica, both physically and emotionally, she will recover from that, and then we can have a detailed chat with you. We can also involve the fertility specialist, and if you don't want to talk about it, we can defer this consultation. That's how you should answer. So it all depends on what they want to know. You just have to give it in a nutshell, not like how Dr. Fatima asked that, do you want to know about the surrogacy? No, he's not interested. So just leave that. And if he says that, no, I don't want to know about it, you just say that I understand it's a difficult time to talk about it. And this is not the ideal time to talk about it. Okay, so we can defer the consultation, and we can have another discussion about the fertility options once you guys are ready, both physically and emotionally. That's all should be your answer. You got my point, Dr. Pooja?
yes.
Yeah. So don't go and discuss. Even if you have not discussed the surrogacy, it's not like your marks will be deducted. So there, the lay examiner who will be interested whether the doctor who is performing this task has the situational awareness or not, whether they have that mindset that whether it is an ideal topic to discuss or not at this point of time. You just have to give the options, and if he's not interested, just leave it. Right?
Yes.
Okay, perfect. Right. So, anyone who wants to add something? Yes, Dr. Sarika, you have opened your camera. You want to add something?
Yes, ma'am, Fatima did, I think, good, as
Okay.
you were a
Right.
very tough role player.
Okay. Anything you wanted to add? Any input you wanted to give?
I was just confused, ma'am, when you told like that is this complication has not discussed. So
Mhm.
exactly what to say like that
Okay. I'll
before
come to
at
that.
that moment.
Okay. That's good. So, first of all, I'll start with so before I go into feedback for Dr. Fatima, I'll just tell you that what was the background history in here. Okay. So information gathering was also there. Okay. Information gathering, that domain was also there. You should not forget that. And this information gathering doesn't mean that you go and ask about medical conditions, surgeries, allergies, BMI, blood group. Okay. Not these questions from the role player who is acting as a husband. We're not interested in that. What we are interested is the gauge his background knowledge, that what he is aware of, what has led to this. That is the information gathering that you have to gather, and establish that he knows this much, and from there I have to build the topic onwards. Okay, understood everyone, that what is this information gathering? Because I have seen people gathering a lot of information in some situation like this, where you're breaking the bad news, you're giving him the tough time, and go on and asking about whether Erika had any medical conditions, surgeries, allergies, BMI, blood group, addiction, support, blah blah blah. No. Okay, that's not what we are interested in this particular topic. It's about what he knows. Establish his background knowledge is all about the information gathering that we are testing in here. Okay. So this couple has been trying to conceive for the past 4 years. Okay. And then they underwent all the investigation and they got to know that there is a fibroid. And then after discussing, going through the consent, they consented for the UAE procedure 1 week back. Okay. And she was discharged on the same day. Of course, it's a daycare procedure, but then she developed mild fever and pain. Then, and also the vaginal discharge, and they went to the GP, and then they have given some antibiotics, but the symptoms persisted. This morning, she collapsed at home. So, husband brought her to the A&E. So, this is the information that you have to gather from him. Even though it has given as a background information, it's important that what he knows about it. That is important. Then he what has been told to him about the surgery, that also is something that has to be told, because before shifting also he would have been briefed about Erica's condition, that what's going on. So that's also important for you to gather from him. That is the information gathering I'm more interested in, right? So they told that it was badly infected, and then they have taken for her for the emergency cesarean section, but he's standing outside the ICU, anxious, exhausted, emotional, and he hasn't spoken to anyone about it yet. Okay, he can raise his voice at times out of anxiety or frustration, but he's not the aggressive one. Okay, so read the role player instructions as well. That will also give you a lots and lots of information about the role player behavior that you can anticipate in the exams. If you anticipate the role players reactions, the questions, then the station will become a cakewalk, indeed a cakewalk. So my question to you, Dr. Fatima, is that you told you are in the emergency department. Okay, don't get confused that she came to the emergency department, but then she underwent a surgery. Okay, right now where is she? She's in the ICU. Okay, have that situational awareness as well. It's important that you need to communicate with him saying that she's in the ICU, and you might expect a reaction by him that why is she in the ICU, and it's your duty to go and say. So when the why I'm stressing upon this is that many candidates would say that she's in the ICU, and moment you say ICU, any debriefing stations for that matter, they would immediately break the news. Okay, that she is in the ICU because we had to remove her womb without any structure, without any breaking bad news template. They will go and tell that we have removed the womb. That's the reason that she is in, or she had a heavy bleeding and we had to remove the womb. This is why she's in the ICU. So any debriefing station for that matter. So you expect a reaction from him saying that why is she in the ICU, and it's important that you need to tackle that as well. Okay, that is one thing. So that is one input for you, that have situational awareness and where are you talking to him, okay? Whether you're talking to him in the ward or ICU, that is something that you should have in mind. The patient was assessed in emergency department initially, but right now the patient is in the ICU, okay? Second thing is that you confirmed that you are speaking to, who is that? Mr.
Michael.
Michael White. Okay, confirm it fully that am I speaking with Mr. Michael White, husband of Mrs. Erica White? Okay, I'm one of the doctors here looking after Mrs. Erica White. Okay, confirm the full identity of the patient, that you are speaking to Mr. Michael White, yes, but who is he? The partner of Mrs. Erica
Erica.
White. Okay, that is one confirmation thing I wanted to tell you in here. And then you assumed that he should be knowing something like this has happened. So your conversation came in the beginning that you weren't expecting something like this, and this has happened. I know both of you were not expecting something like this. I'm really sorry whatsoever. But then again, it was lack of structure, because it has to be done in a proper breaking bad news template. I mean to say that you need to set the scene properly, offer a
Mm.
support, that whether he wants to have someone with them. So do not assume. Instead of that, what you should be doing it. Immediately you go into the cubicle, you confirm his identity, you don't know how to start, don't worry. Just acknowledge that he has been waiting for the past 3 hours, isn't it? That's what they have been saying. So that you acknowledge and have a situational awareness that I'm really sorry, Mr. White, that I had to make you wait for last 3 hours without any communication from our team. Now I'm here to discuss what went, in the surgery, and discuss and answer all your concerns. Keep it in a neutral way, no white or black. Keep it in a gray area. Just say him that apologize for the delay. Nobody has communicated anything, but now you're here to discuss the surgery details and everything and answer all his concerns. That should be the agenda. Clear, my dear?
Yes, ma'am.
Yeah. And then you went on and on, and you were kind of, because he became defensive. And what happened? What are you trying to say here? Because he doesn't know whether the womb has been removed or not. So do not assume that he has already been briefed about it, because it is clearly given that he has been waiting without any communication. That means that you are supposed to break the bad news there. Okay. And the
Mm.
rest, the structure was okay. You mentioned about the MDT, who are all were a part of the MDT, and you also, the tone was good, and you were giving the information in chunks. You did not go and disclose that the womb has been removed. And even when he asked that who has given you the consent and things like that, you told that it was done in the best interest principles in order to save Erica's life, and this will be formally investigated. So all the points under the clinical governance also you try to cover there. A few questions were not really tackled in detail. Like they mentioned that the GP, that we went to the GP, and he has prescribed some antibiotics. So why wasn't he picked up this infection earlier? Maybe we could have saved the situation, or we could have prevented the situation altogether. So somewhere that point should have been addressed a little better. And
What?
then,
Tell, ma'am. Sorry,
yeah,
I'm.
yeah, I'll come to that. I'll finish your feedback and take up the answer template. Okay.
Okay,
And
ma'am.
do not use the words egg basket. So we don't use, even working in the UK, we do not say that.
Okay. Mm.
You say ovaries. Okay,
Oh,
if
yes,
somebody is
okay.
teaching you egg baskets and all, forget it. Everybody
Okay.
will say ovaries. Even in the
Okay.
consent, it's ovaries.
Okay,
Okay,
ma'am.
right.
Okay.
And then also has addressed by Dr. Pooja and other people that if they are not interested, if they look they look let down by all the actions that you have made, and they're not interested in your surrogacy or other options, don't poke them and discuss
Mm.
much about it. Okay.
Okay.
Yeah.
Mm-hmm.
And also another question that I asked, that I want to sue the hospital, and then you
Oh,
told about the patient advice and liaison services. So he also told that I'm not interested in that. I don't believe you guys, and I want to sue the hospital. That means he's trying to tell you that I want to take the legal action. So what should be your answer?
um,
If anyone else wants to give an input on this,
there's a legal advisory committee also, right?
Yeah,
who's that? Anyone who wants to say something? No one? Yes,
patient
Dr. Bhaskar?
organization services, Pulse office.
Yes, Dr. Basma, what were you saying, dear?
I will guide him for the Pulse office.
Okay, PANS is already being told. That's for inside hospital process. The patient advice and liaison services will come into your hospital investigation process, the feedbacks, the complaints, and everything. But then he doesn't want to contact them. He wants to go and sue the hospital by taking the legal action. So how do you want to address that?
We can
And
say that
Yes, Dr.
we
Pooja?
can we can say that yes, that is completely your right, and you can go for the legal action.
Mhm.
But from our side, from the hospital side, we will generate the incident reporting, and the results of those incident reporting will be shared to you.
Okay, I'm not interested in that. I don't want to know the results.
He should wait for the result for the internal investigation first, because already the court they will ask for our investigation to be done.
Yes. And
Yes.
also, at the same time, it's better. You cannot say like, you wait and you have to wait. No, it doesn't work like that. Okay, he has all the decision to go against you and take the legal action. That's fine. But the thing is that when they take the legal action, they have to contact their own solicitors, the lawyers, the independent lawyers, and he has to bear the expenses. And it's like, you know it's important that he should bear in mind that it will affect the internal investigation which is going on at the trust level. It might affect it, it might even halt it. Okay, it's always better to wait for internal investigation to conclude and have those results communicated to him in a more open and transparent manner. And some families will feel dissatisfied even after listening to it. They can go and take the legal actions. So it's better to wait for the internal investigation to conclude. Otherwise, that will affect the investigation. It can even come to the halt. Okay, that's what you have to tell them. Understood? Yes, dear Basma?
The hospital also provide the legal services if such incidents arises.
They will give the information. They'll give the information. Okay, they will guide how to go about it, but at the end of the day, the hospital will not bear the expenses of it. Okay, the
All
trust
right.
will not bear the
So
expenses.
bear the expenses, but they there is some services in the hospital or the units as such that if such incidents arise and the patient or the couple wishes to
Yeah.
sue the hospital, is any legal the services available in the hospital?
No, no, no. They don't directly give. That's what they'd say. That from our side, because it's all the government, no dear. The NHS itself is a government. Okay, so it's not the private hospital or the settings that we are dealing the patients with. So this is the government-led hospitals, and everything is controlled by the government. So first, they should allow us to do this incident report and do the investigation process. And then once we have the results, that will be discussed by the consultant and along with the governance meeting team, that what has been gone wrong, right, all those things will be discussed. Okay, and this PALS department also have the responsibility of giving the information on how to go about these legal things as well, but they will not directly facilitate this. They can give the information in the form of information leaflets, okay, that whom to contact, how to go about it if you feel that you're not satisfied it, but they will not help you in hiring a lawyer for you and things like that. Okay,
Okay.
it's only the information that they can give, that how, but otherwise they have to do it in the private settings. They have to hire a lawyer, the solicitor, and they have to bear the fee, and sometimes that can halt the investigation altogether, and everything will be escalated from there. Okay, perfect. So now we will move on to the so you did a good job, Dr. Fatima. I'll just quickly take you guys through the answer template. So the questions that the role player can ask in this particular task is that, how can you just go ahead and remove her womb without our consent? We never consented for this particular procedure. Did anyone even try to save it? They told me that it was a safe procedure. All they explained me was it's an infection, bleeding, or a fever. How did this happen? And why did the GP only give antibiotics? Why didn't he refer earlier? Couldn't this have been stopped earlier? Okay, couldn't have this been prevented earlier? And how can we ever have the children now? And have you spoken to your my wife? And is she awake? I want to see her. These are the things that you can expect out of the role player. Okay. So before I go into the answer template, any questions from anyone? No? Right. So the first is introduction and identity. So quickly confirm that I am Dr. Deepika, one of the doctors working here or looking after, Mrs. Erica White. Am I speaking with, whatsoever the name of the role player is, and confirm that he is the partner of Mrs. Erica White, right? And then do not jump into any discussions there. Take it slowly. Apologize for delay there. Okay, that he has been waiting for the past 3 hours without any communication from the team members, and you tell him that everyone was busy looking after Mrs. Erica White, or everyone was busy in the surgery of Erica's White, and now that I'm here, I'm going to address all your concerns, and I can see that it was an anxious wait. Please accept our sincere apologies. Okay, apologize. That's also very, very important part of your clinical governance. And then gauge the baseline knowledge. He might say 100 things that, where is she? I want to see her. Is she okay now? Then be honest and tell him, but don't disclose every information there. Just tell him that, she's in the ICU. She's stable. She's looking after by a team of doctors. Okay, I will make an arrangement for you to go and see her at the earliest, and she has already given the permission to come and speak to you. And then the moment you say that, he will be like, why is she in the ICU? Okay. And then again, acknowledge his, I mean, the anxiety and, the distress there. I can see that you're quite anxious, but don't worry. She is in the ICU because we wanted to closely monitor her. Okay. That's it. If somebody had a heavy bleeding and had a PPH and hysterectomy, you don't have to go and say that she had a hysterectomy. That's why we are managing her in the ICU. No. Just say that she had a heavy bleeding. Okay, she had a heavy bleeding and she required some blood and blood products, and that's why she has been closely monitored. Similarly, here, because she wanted some closer monitoring there, she's in the ICU. She's doing good now. Reassure once again, she's doing good now. She's stable, and I will make an arrangement for you to go and see her at the earliest. As simple as that. Keep it simple. Then you gauge the baseline knowledge. That is where your information gathering marks are there. Dr. Fatima, you did not take any history from him. Okay, don't do that. There is one whole domain altogether which is information gathering. So gauge the baseline knowledge there. That, before I go into discuss the surgery details and what happened to Mrs. Erica White, I want to hear from you that what has led to this and what has been told to you by the team prior we shifted her to the surgery. This is what you should gauge his baseline knowledge. Then he will tell you his story. The doctor, we were trying to conceive for the past 4 years, and then we were longing for the baby, and we underwent so many tests and investigations. She was found to have a fibroid uterus, and then everything was discussed, and then we consented for this uterine artery embolization. Okay, he has given this much information. Then ask him, what happened next? What happened later? Then
Okay.
everything was fine, doctor. Then we discharged on the same day and we went home. She was all okay, and suddenly she developed this fever, discharge, and she was feeling unwell. And then we went to the GP. Okay. Then what happened? Yeah, he just gave her some antibiotics and he told it some sort of infection. Everything will go fine. And then we went home, doctor, but the pain persisted, fever persisted, and all of a sudden she collapsed, and I had to take her to the emergency department. Oh, then you pause, and I'm really sorry. That must have been really difficult for you and Mrs. Erica White. You did a good thing that bringing her to the hospital at the earliest. Then what was told to you before the surgery? Well, doctor, she was, they told me that she's having some infection or something. I'm not quite sure about it. So she was taken to the emergency surgery, but I don't know after that what happened. So this is the information gathering that you should ask from him. Clear,
Okay.
Dr. Fatima? Yes. So now you understood his background knowledge, so that now okay, fine. So this much he knows, that he was the one who brought her to the emergency department. He knows almost all of the story here. So now from there, I will start the station. Then you would say that, okay, fine. I'm going to address all your concerns. So I'm going to discuss what happened with Mrs. Erica White during the surgery. I'll explain things step by step and take you through the surgery findings and everything. So if I am rushing too much or something, please stop me. We can go at your pace. And then you can tell him that would you want to have, okay? That is basically you have to uh, start your breaking badness template by creating that atmosphere, the privacy and support and things like that. Just ask him that you want to have someone like one of our nurses or somebody else to be with you as we go on to discuss. He will say, no, doctor, you can just tell me. Okay. Then take the events. Okay. That yes, as you are aware, Mrs. White came to the emergency department in a collapsed state. Then what happened? Then she had a pulse, her pulse was high, blood pressure was on the lower side. She was very unwell, and we were suspecting an infection, and we wanted to contain that infection. So that's the reason that why she was taken to the emergency surgery. And in the surgery, what happened? You have to explain him that we identified the womb was infected, okay, and it was necrotic. Necrotic, if you use the word, it will come across as a medical jargon. But if you explain what is necrotic, then it is not taken as a medical jargon. You have to say, I mean to say in simple words, the tissues were very fragile, okay? And then you give another information in chunk that it was nearly impossible for us, to save the womb because it was looking really bad, and the only safest way out for us is to remove the womb. Just pause. Okay? Then he would say, how can you remove the womb? What are you saying? Are you talking to the right person? All that questions he might ask. Again, you don't have to explain him anything that, I mean, go and justify that. Why did you do that? All you have to say is that I'm extremely sorry. Just apologize, apologize, apologize. I'm extremely sorry to be the bearer of this news. I know this has come as a shock to you. I can only imagine what you're going through, right? But this was indeed a difficult decision for us as well. Our senior most consultant tried all the measures in order to save it first, but then, unfortunately, it wasn't possible for us to save the life. I mean, save the womb there. Then he would say, like, how can you do that? Have you never consented and all? I understand your concerns. These are very valid questions. But when keeping such the infected womb inside the body, what it would have lead to, that is what you have to explain him. So when we keep such an infected womb within the body, that will act as a source of infection, and then that can spread to the rest of the body, and that would have put Erica's life at risk. That's the reason that we had to make difficult decisions and we had to proceed in best interests principles in order to save Erica's life. I'm really sorry. Do you need a minute? Do you want to continue the consultation or do you want me to defer the consultation? Please accept tissues or do you accept the water? Just have some silence there. Okay. Then he talks about that, something like this was never told to us. We never had a discussion like the womb removal is also this. I mean, we didn't even have the slightest information that womb also could be removed as a part of this procedure. So you tell him this is where the clinical governance of your applied clinical knowledge points are being tested. That he's saying that something like this never discussed. Other students, what they do and how they lose marks is that they say that everything will be explained in the consent. Every complication will be explained to you, including the hysterectomy. They say this because you're taking it as a defensive mode. Don't do that. All you have to say that I'm really sorry. Again, the tone, the body language, I'm really sorry. I can totally understand what you're trying to say. This is indeed a rare but a possible, a recognized complication of uterine artery embolization can happen in less than 1 in 100. But even if you don't remember the exact number, that's okay. You can say that it's a rare complication that can happen. Most of the times, we explain all the risks and complications, including the rarest possibilities. But definitely, I will look into this, your consent, the documentation process, and everything, what has been communicated to you, what has been missed, and we will take this seriously. And I will raise an incident report, and this will be formally investigated, and results will be communicated to you. I'm really sorry. So reassure him that something must have gone wrong, something must have not acknowledged, and say him that something must have not been communicated to him rather than being defensive. This,
Yeah.
Dr. Fatima, you did really well. You told him that you will look into the consent. Something usually we will tell everything in detail, but looks like something there has been a miscommunication, something like some things that must have not
I
been communicated to you earlier. So definitely we'll look into the consent process and get back to you. That's all you have to say. All right?
Yes, ma'am.
Then another question is that why didn't the GP tell us anything? Why didn't he escalate it earlier? It should have been picked up earlier. Maybe we should have avoided this, entire situation altogether. Again, say them that, yes, I hear you. And tell him that you cannot comment on the individual decisions on that day without knowing the entire conversation. But reassure him that you did that somewhere else. Reassure here that you need to support your GP at the same time, not being very defensive about it. You just have to say that, let me reassure you, all the doctors who are working in the NHS are deemed competent after thorough, evaluation, and everyone's aim is to,
Give the
protect
right.
and keep the patient safe always. But definitely we will look into that as well, that why the GP's decisions was into that direction. And also you have to tell him that antibiotics is something that we generally prescribe in the beginning when we suspect an infection, hoping that infection would be cleared. Unfortunately, this complication has occurred despite prescribing the antibiotics. That's what you have to say there, because prescribing antibiotics was not the issue there, isn't it? So that is something that we generally do it. So that's what you have to tell. And at the same time, Your colleague, you should not undermine your colleague. Just say that I cannot comment on the GP's decision without knowing the entire scenario that day. But definitely we will look into it. But let me reassure you that all the doctors who are working in the UK are, NHS are deemed competent after thorough evaluation. And this we are not going to take it lightly. We will take this seriously and we will raise a complaint and look into it, what has gone wrong. Okay? This is how
Okay.
you should explain this. And the
Okay.
next question that he asked was that how will we able to become parents again? Again, you have to signpost there and tell that I know this is not the right time to talk about it, but there are certain options that if you want me to explain, I can explain, or we can have another discussion altogether. If he says that, okay, yes, you tell him that the womb has been removed, but the ovaries have been conserved. That means that we can take the eggs and then mix it with your sperms and you can have very much biological child, but another female has to carry the pregnancy for you, what we call surrogacy or the adoption. But I'm not going to discuss anything in detail about surrogacy or adoption. I'll just quickly say it in a nutshell and tell him that this will be discussed with you in detail later by our fertility counselor and fertility specialist when you guys have recovered both physically and emotionally. Okay, that's it. So that's where you get your marks from applied clinical knowledge as well. Then what you did not cover. Okay, what you did. So these are the key concerns that we discussed, right? Why was her womb removed without consent? How did this happen after a safe procedure? Could this have been prevented by the GP? Can I still have children? So once you have all of this, please bear in mind that you still have got few domains to cover which you have not even addressed. That what is it? Communication with the colleagues, and I'm not saying it to you, Dr. Fatima. In general, I'm talking.
Yeah, no, no.
Yeah. So,
I'm
so what are those three domains? Communication with the colleagues that we haven't even addressed yet. We are talking, and then applied clinical knowledge. A part of applied clinical knowledge is still missing, and patient safety points are also missing. Patient safety, we have not even come to it yet. So, what you should do is that you have to immediately say, "Don't worry, I want you to be strong so that you can look after Erica in this difficult times now. She's in safe hands. She will be looked after by a team of doctors." Okay, who are all the team of doctors in here? You have to mention everyone, otherwise you don't get marks. Just by mentioning your consultant or one or two names, no, you don't get, you get a borderline. Please, you have to mention everyone on the board. You have to mention the consultant obstetrician, you have to mention the ICU specialist, the intensivist, the anesthesia doctors, the sleep doctors, okay? And then you have to mention about the infection specialist, the microbiologist as well. Okay, and then the counselor support groups, GP also will be later part of it. So everyone you should mention to get the marks under the the communication under colleagues. So that domain is sorted. You finish that in less than 30 seconds. All right, then how she is being cared afterwards is also marks under applied clinical knowledge and patient safety that you should cover. That she will be managed in the ICU, okay, and she will be expected to have some drains, the fluids and tubes, but then we will remove it as soon as we can and then continue the safer antibiotics, safer painkillers after ruling out allergies. Thromboprophylaxis, most important patient safety point. So you have to tell him that we'll review her bleeding risk and also the clotting risk, and once it is safe to do so, we have to start her on blood thinners as well. And until then, we will put her on stockings and early mobilization with the help of physiotherapist. And so these are the things that you have to say. There's support groups, counselors, everything. That also has to be completed. And the this yes, we have finished the datics that we have already told that you will raise an incident report and formally this will be investigated. And about the legal actions, you have to say that generally what we advise. Generally, in a situation like this, what we advise is to wait for the incident report to be completed and the investigation, the full formal investigation to be concluded. And even after hearing us that you feel that you're not happy about the outcome, you can still go against the hospital and you can take the legal actions. But all you have to remember is that this would take time, this would take your energy, this would take your money, and sometimes this will affect the internal investigation that is going on. So what we would suggest at this point of time is that just give us some time, wait for this investigation to conclude, and even after listening to it, if you feel that you're not satisfied, you have all the rights to do it. That's how you should answer this legal action. And complaints, yes, the patient advice and liaison services, that anyways you guys are saying it, no problem at all. Other safety points related to the subtotal hysterectomy. Okay, so this she underwent a subtotal hysterectomy. So sometimes they mention it directly that it's a subtotal hysterectomy, sometimes they don't. So if they have mentioned it, you can go and say that we were able to remove only the womb and leaving the cervix behind. So she still has the neck of the womb, so she can expect some withdrawal bleeding monthly. Okay, the possibility of withdrawal bleeding monthly. And second is that she has to continue with the cervical smear. So if you don't address this, that the RCOG look at it as a patient safety compromise. That's because you are the one supposed to tell them that they have to continue with the cervical screening, isn't it? And if later she thinks like I have removed my womb and things like that, I don't have to undergo the cervical screening, and if she ends up with cervical cancer, retrospectively they can sue us. That's why it is a patient safety point. Okay, so that those are the 2 points that you should cover under subtotal hysterectomy, and then you tell them that another follow-up or a debrief consultation that will happen with a consultant, and I will ask my consultant to come and see you at the earliest. So this is how you should cover the station. Okay, any question from anyone?
The questions were mainly for his shock. He was in shock. Then about the post-op care and about the cervix and bleeding, what he cares. He's not worried about that. That we should tell her only in the post-op period that your
In
womb
that
is
way,
something.
in that way, for that matter, we should not be telling him anything. That way, we should not be telling him anything for that matter. Okay, this is for your mark. So don't be very logical in there that what is the point of telling this information? You're saying this, that's the reason because you have marks under applied clinical knowledge, the RCOG is marking. Got it? I
Mhm.
get your point. In that way, we don't have to explain him anything.
But
Okay?
he was so angry. He was so stuck with that.
Yeah, that is in the end that you have to say that, how many ever times that he throws tantrums at you, you should not lose your calmness there, and you have to say that, don't worry. I know this is difficult, and this whatever I'm explaining will not take away your pain. But let me tell you from here onwards, what are we gonna do to make
Okay.
sure that she is safe? That has to be told to him as a part of communication with the patient's relatives. Okay?
Um,
Yeah, right. Okay, any question from anyone? Any question, any doubts? Is something is not clear? No question? There are 30 candidates here. No question? Okay. At least tell it is clear, guys. At least I understand that much.
Yeah. Thank you.
Right. Okay. So can we have the next task then? Who wants to be the
Me.
volunteer? Thank you, Dr. Fatima, being such a good sport. And presenting in front of 30 people is not joke, okay? This requires the dedication, and this requires the determination. This requires some courage to present in front of people. Okay, thank you so much. I really appreciate it. Perfect. Yes, Dr. Sarika has opened her camera. That means she is ready for